Batteries. Great reminder, Sam. All right, for many individuals and their families, the decision to age at home can be complex and complicated. Sorting out logistics and the best plan of care for an aging loved one can be daunting. Here to talk about the programs and services offered by Hartford Healthcare at Home is Debbie Taylor, Clinical Manager for Hartford Healthcare at Home in the Fairfield region. Debbie, welcome.
Thank you so much. Thanks for having me.
Great to have you. So what clinical criteria is needed to qualify for home health care?
So an individual needs to have a few things. There needs to be some sort of an acute change in the health care status of an individual. We need to have a physician's order because we work under doctor's orders. And there needs to be what we call a skilled need. And that's teaching of a specific disease process and how to manage that disease process, or medication education and management, or teaching of a home exercise program or strengthening activities, or instructing on activities of daily living to help a patient be more safe at home.
All right, what types of in-home services does Hartford Healthcare at Home provide?
Hartford Healthcare has a variety of services. We offer skilled nursing, there's physical therapy, occupational therapy, there's speech therapy, also medical social work, and home health care services, home health aid care services. We also have specialty programs. We have a wound care program, we have a behavioral health program, also palliative care and hospice services to help meet our patients' needs.
Excellent. What a broad range. What are the advantages to your programs? What makes them different?
Sure. So Hartford Healthcare at Home is part of a much larger healthcare system, and there are entities that will help meet a patient's need at whatever level they need. They're hospitals, rehab, outpatient rehab facilities, nursing homes, home care. So for continuity of care for the patients, it's really great. We also have one electronic medical record. So that makes it a little simpler for the patient as far as each provider being able to communicate with each other and the collaboration between the providers involved in the patient's health care.
That technology has made things so much easier. All right, who pays for home health care services?
So most individuals' health care plans will pay for home care. Some people may have copays or deductibles, but at the initial start of care visit, the clinician that is there will review that person's health care benefit, so they're aware of what would be covered and what would not be covered.
All right, and quick last question, where can people turn for help?
So we at Hartford Healthcare cover, we have 5 huge regions across the state of Connecticut. So if anyone is interested in a particular town, they can call 1-800-HOME-CARE.
All right, simple. Debbie Taylor, Clinical Manager with Hartford Healthcare at Home for the Fairfield region. Thanks for joining us.
Thank you. Take care.